stress disorder in women. When a person experiences a shocking or traumatic event, it's normal to react with strong memories and feelings. It's part of how we learn. But when these responses don't fade over time and start to interfere with day-to-day life, a person may start experiencing post-traumatic stress disorder. Post-traumatic stress can be a crippling disorder, interfering with a person's ability to function on a daily basis. And it occurs twice as frequently in women as in men. The details of the event stay with them, like the people who were there, the environment they were in, even little things like what they were wearing. Those details can act in the future to remind them of the event and cause them to have some sort of fear response. Researchers have found links between the amount of an estrogen hormone in a woman's system and her ability to successfully respond to treatments for post-traumatic stress disorder. Rebecca Shansky, an associate professor of psychology at Northeastern, is trying to understand this connection by mapping the brain signals of female, in the hope that her findings will lead to more effective treatments for women. With careful conditioning, the brain can relearn that those cues don't always mean danger. But for women, the effectiveness of this exposure therapy may depend on the level of estradiol, a type of estrogen, in their body. Women with naturally high estradiol levels, seen at that peak across the menstrual cycle, do better at this extinction learning. Increased estradiol levels seem to be influencing the brain's production of dopamine, a chemical that transfers signals between neurons. Dopamine is important for learning and forming memories, including retraining the brain to realize that those innocuous details don't signal something frightening, a process researchers call extinction. By examining the brains, and comparing them to other females undergoing the same experiment at different points in their estradiol cycles, Shansky hopes to isolate the specific neurons activated by estradiol during the extinction process. We can then create a map, essentially, of what different parts of the brain are involved in this response, how they connect to each other, and if they are different when they have high versus low estradiol, Shansky says. This map could indicate ways to improve results of exposure therapy for women. Just giving women extra hormones could have a lot of side effects, but if researchers can understand exactly what cellular mechanisms those hormones are triggering, they may be able to mimic that result with other treatments. Therapies for most mental illnesses are non-sex specific. If we can find that there are actually novel mechanisms in the brains of female that we can take advantage of to help treat them better, that's the whole goal. Thank you.